Welcome to the Be Well Collective, a refreshingly grounded podcast dedicated to separating health fact from fiction, offering listeners access to credible, science-based conversations on a wide array of health topics. Each episode features discussions led by medical professionals and experts, providing listeners with the evidence-based insights to navigate the often confusing world of health and wellness with confidence and clarity. Now let's nourish our minds and get into it.
Hi, welcome to the Be Well Collective. I'm Riley Speth, a clinical mental health counselor. I'm joined today with my co-host, Sara Hillring, a sports and clinical dietitian. What's up, Sara?
Hey, lady. Great to be back on the pod with you. I'm good. I'm excited to learn. How about you?
Yeah. Feeling eager.
Feeling eager. Rock on.
Well, Sara, what's our topic today?
Yes. So today we will be covering trauma-informed care. The term trauma-informed can sometimes be used as a buzzword when applied superficially or without genuine application. However, its meaning extends beyond its trendiness to represent a set of principles for understanding trauma's impact on behavior and create a safe and more supportive environment. While increased awareness has led to some misuse, true trauma-informed practice prioritizes safety, trust, collaboration, and involves concrete actions like policy review, professional development, and listening to feedback. All lovely things our guest is going to get into.
Yeah, such an important topic and something I think we hear a lot in the world, but a lot of people don't really know what it was. I mean, I have to admit, even in grad school, I feel like I didn't get a full grasp of what it was,
100%.
right, until I was in it and learning more about it.
Absolutely.
So I'm going to start us off today and introduce our guest, Chloe. Chloe graduated in 2024 from the University of Northern Colorado with her master's degree in professional counseling, which was focusing on couples, marriage, and family therapy. In her undergraduate studies, Chloe studied nutrition and dietetics, which also ignited a passion for the mind-body connection and the impact of lifestyle on mental health. In the summer of 2024, she began working at a community mental health agency in the intensive youth and family program, providing intensive outpatient therapy to adolescents struggling with trauma, mental health issues, and substance abuse. In July 2025, she transitioned to a traditional outpatient setting and now gets to work with clients across the lifespan and spectrum of experiences, which she loves. Her clinical interests include trauma, anxiety, and improving relationships through a systemic approach. Chloe, we'd love to hear a little bit more from you. Tell us more about how you got into the field.
Yeah, absolutely. Well, thank you so much for having me. I got into this field because I've always had a drive to help. I started out with wanting to help people through diet and physical health and working with people on that sort of level. And then through studying nutrition, I recognized how many of our choices stem from our mental health first and then kind of spread to the whole body. After undergrad, I had a lot of different jobs and was exploring all sorts of different things. And I ended up working randomly in a law firm where I realized that, everyone has such a rich inner world and such different stories and experiences. And working in a law firm, my favorite thing about the job was connecting deeply with clients and hearing their story and being a support for them. And then one day I just realized that could be my whole job and that's what mental health clinicians get to do every day. And so I applied to grad school and I really never looked back. This has been the thing that I have been passionate about and have loved doing. And I got into the couples and family therapy specialization because I realized we really can't heal in isolation and we really need each other. And I believe that in relationship is where our healing happens.
Absolutely. Wow, Chloe, that's amazing. I think your passion is really palpable, right? Like, couldn't you just feel that coming through with what you do in the field that you've gotten into? And I think you have as many of us do, such a fun journey into finding that and finding like, this is a career and I can do this and I can serve people in this way every single day, which you show up to do, which is awesome. So thank you for sharing that. That's such a fun introduction to you. Before we get into discussing trauma-informed care, we always like to start out each episode in a fun way. We kick it off with what snack either we each brought to the pod or simply a favorite snack of ours at the moment. And we always let our guest start first. So, Chloe, what is your snack of choice today?
Today I have sliced cucumbers with the Trader Joe's roasted garlic hummus. It's like my favorite snack. It's crunchy, fresh, but also has some protein, keeps me going through the day. I'm very passionate about cucumbers as a snack. I just like the crunch.
Yes.
They're just delicious.
That's so versatile.
I love that. And it's very balanced. Look at that. You're like, I have my protein. I've got my cucumber. I've got my texture. It's great. Oh, that's amazing. I wish I would have brought that today. Yeah, I'm feeling inspired by that. What about you, Riley? What did you bring?
So I had my snack just before coming here because
Fantastic.
it was an overloaded acai bowl.
Oh, great.
So I didn't feel like that would be appropriate eating while, recording this podcast.
Sure.
So yeah, it was really good. I had all the toppings. I was nervous the place that I ordered from would be like, ma'am, no more toppings. Like, stop.
Ma'am, no more. You're done.
Yes. So acai bowl was my snack of choice today.
Love it. What was one of the toppings? I have to know.
Okay, today I got chocolate dipped, mini peanut butter cups.
Oh my.
Fun. I feel like I'm understanding the importance and the amazingness of peanut butter as I get older.
Yeah.
It was actually you bought me peanut butter cups a year ago.
Yes, I did.
I hope you know I'm obsessed now.
Oh, I'm so glad.
So,
I value peanut butter very much, so I'm glad to be spreading the good word.
Yes. Okay, enough about my acai.
No, that sounds lovely.
What did you bring today, Sarah?
I think this is my most underwhelming snack of the entire podcast series. And I hate to admit that, but you know what? No one's perfect, so dietitians included. It's not a balanced snack. I have cuties. They're great, and I have just been running around all day, so that is what I had. It's a little good vitamin C dose.
Yeah.
Everyone needs immune health support no matter what time of year, so I am supporting my immune health with some vitamin C.
Yeah, good time of year for that.
It is a good time of year for that. Absolutely. Yeah. Well, thanks for indulging in the fun of that. I appreciate it. I think it always sets a good tone for us, but we'll get on to the main event. Chloe, we're really lucky to have you here. I hope you know that. I am really stoked to have you join us and talk more about this topic because I think it is so valuable, and often maybe as many of us want to get education on it, we don't in our initial practice or as we're going through, grad school and our initial studies. So we really want to have you run with this, and Riley and I are here to learn. We both use trauma-informed care and approaches in our practice, but we're so excited to have you really give us a deep dive into it. So let's begin, Chloe, with asking you about the very basics. What trauma-informed care is and why is it important?
Yeah. Well, right back at you. I feel very lucky to be here, and I'm really glad that you all do this. So trauma-informed care is a way of existing as both a provider and just as a person in the real world. And it's a way of existing with the understanding that everyone you interact with could have an underlying history of trauma, potentially completely unknown to you, that causes them to think, feel, and act the way that they do. It's a way of approaching people with taking into account that everyone you may come across has been through something, has survived something, or is maybe currently dealing with something unimaginable that you know nothing about. As a provider, it's keeping in mind that many of the people you work with have been hurt by another person. Often in the mental health field in particular, people are coming to us because other people have hurt them. So it's emphasizing the importance of a thoughtful and respectful relationship with your patients or clients as the center. Like I said before, the respect in the relationship is the road to healing. If you don't take a trauma-informed approach, you could unknowingly harm someone, and then they may not be willing to trust you, and you may not be able to effectively help them in the way that you want to. It's important to take into account everywhere in the helping professions, everywhere in the healthcare field, because trauma affects all health-related outcomes. And so every provider is going to need to take this into account, not just mental health care providers. When it comes to trauma, I like to share the invisible backpack metaphor. Everyone you look at, everyone you see is carrying a really heavy invisible backpack. And it might be filled with the traumatic events that have happened to them, their daily stressors, things like systemic oppression can fill their invisible backpack. And so if someone seems weighed down or like they're carrying a heavy load, they are. You just can't see it.
Yeah.
And then trauma-informed care is, most importantly, it's something you can feel in your body. Like, you know when you're providing trauma-informed care and you know when you're receiving it. You can just feel it in your gut.
Yeah, thanks for that, Chloe. I think that it's so important to keep in mind that as a practitioner, whether that be mental health clinician or dietitian or, various providers, we hold such a privilege, but also a power. And it can be re-traumatizing to people, I think, a lot of times. And so this trauma-informed care approach is crucial because we do hold such a power. So that was a really helpful explanation of what trauma-informed care is and why it really matters. Kind of helps set the stage for this podcast episode and just gives us a general understanding of how you approach clients. We may approach clients with this sensitivity and awareness. So now I'm wondering more about something that comes up in these conversations is the difference between PTSD and complex PTSD. I think it's something that a lot of people don't really know what the difference is.
Totally.
We hear both terms. We're not always clear on what really sets them apart. I'm wondering, could you break that down for us?
Yeah, for sure. PTSD, post-traumatic stress disorder, is a mental health condition that can develop after experiencing or witnessing a traumatic event. That event could involve actual or threatened death, serious injury, or violence. It may have happened directly to you or may have happened to someone close to you. And the trauma might have been a single incident or something ongoing. Some things that people with PTSD may experience could be flashbacks, nightmares, or intrusive thoughts, avoidance of reminders of the trauma, mood changes like depression, anxiety, or substance use, changes in alertness like hypervigilance or irritability. You see irritability even more, especially in kids, and then also difficulties sleeping or concentrating. So that's kind of PTSD in a nutshell. Complex PTSD is not currently in the DSM, which is the manual that providers use to diagnose mental disorders, but there's a lot of research on it, and there are a lot of people in the field trying to get it into the DSM. So they're working on getting this in the DSM as developmental trauma disorder. Complex trauma is a concept that describes how chronic, upsetting, and dangerous experiences impact people, especially children. Where PTSD can stem from just one isolated event, complex trauma typically stems from chronic, interpersonal negative experiences like abuse, neglect, or violence in the child's home or community. Because parents or caregivers are often the ones harming the child in situations like this, the child doesn't have the chance to develop a sense of safety and trust in adults. And that disruption of the child's core feeling of attachment is a key element of complex trauma. So, one of the things that happens with trauma is that your beliefs about the world change. For complex trauma, that impacts how your beliefs in the world developed in the first place. It can prevent you from being able to trust anyone.
Mm-hmm.
And people who have been through complex trauma tend to have more intense symptoms than people who have experienced trauma as an adult.
Mm-hmm. Yeah, that's also interesting. And I think that really ties into Chloe, like teed it up so nicely, of how all of that begins to be displayed or show up in our mind, in our body, in our behaviors. Do you mind unpacking that a little bit for us now that you've outlined the difference between those types of PTSD?
Yeah, absolutely. Trauma can really show up anywhere. Something that I ran into a lot working with kids is that difficult behaviors or emotions are typically rooted in trauma. So things that might look like a temper tantrum or really explosive anger or difficult behaviors like substance abuse, self-harm, chronic interpersonal conflict, fighting, getting in trouble with the law. All of these things can be a sign or symptom of trauma and typically mean that there's something deeper we need to be looking at.
Mm-hmm.
It's really important too to keep trauma in mind when you're interpreting people's behavior. So, for example, as a provider, I'm sure we've all experienced clients missing appointments and not calling or not canceling, not communicating with you. And it can be easy to feel frustrated by that. But if you're taking trauma into account, you're thinking, oh gosh, maybe on their drive to our appointment, they saw something that activated their trauma and they had to pull over and now they're sitting in their car, unable to keep driving. And that's why they didn't make it to our appointment. So anytime you're kind of faced, I think as a provider, when you're faced with behaviors like this, it's really important to ask yourself what's underneath it.
Mm-hmm.
And then in the mind, again, trauma changes our core beliefs about the world and the beliefs that we've been maybe holding our whole life have suddenly shifted. And beliefs that can change in one instant may take many, many years to repair afterward and to heal. If your core belief was that the world is a safe place and your core belief is now the world is an unsafe place, that's going to impact how you go about your life. And trauma happens in relationships often. It's one person harming another person. And so as providers, as healthcare providers, we need to remember that as well. And we can be the people who repair that belief that people are dangerous. We can then be a safe person.
Mm-hmm.
I think just such an important piece that you touched on here, and something that I'm always thinking of as a clinician, is interpreting and trying to understand people's behaviors and that kind of core, the core stuff that's coming up for them, trying to understand how this could be trauma that could be popping up for people. So I think thanks for touching on that. I think that's so important. So if I'm someone that's coming into therapy or looking for a provider that utilizes a trauma-informed approach, how can I know if the provider is trauma-informed or not?
Yeah, this is really important. And I want to emphasize to people that they have control over who their providers are. And so above all, please make sure that you're trusting your gut. The person you're meeting with might have all of the qualifications in the world on paper, but if it doesn't feel right, then it's not right for you, and you get to find the right fit. That's something that I tell my clients every time I meet with them for the first time is that if they don't feel that they are safe with me, that they absolutely get to advocate to work with someone that does feel safe for them. Mm-hmm. Some other signs of a trauma-informed provider is going to be someone who is willing to adapt to your needs and is flexible. So, I mean, even like I have some clients I sit on the floor with, or people who need to walk while they talk. And so we walk. There's a lot of different ways, we all have constraints in the way we practice and rules we have to follow, but you want to look for a provider who is willing to work within their boundaries to provide you the care that you need. As a trauma-informed provider, I like to try to ask my clients, what would it take for you to build a trusting relationship with me, as a way to check in on what feels safe to you in a relationship with a provider. Mm-hmm. Also, you can ask yourself, does this provider respect me, honor my autonomy, and try to give me back the control whenever they can? You can look for providers who say they specialize in trauma. So if you're reading about your provider online or however you found them, you can look and see, do they have a background in working with trauma? Is it an area of interest for them? Do they specialize in it? And then you also get to interview your provider. Ask them what got them into the work that they do. Ask them about their previous experiences, their education, their certifications, their approach to whatever it is they're providing you, what their areas of expertise are. All of those are things that you have the right to know.
Chloe, I couldn't agree more, honestly. I loved the way you broke down the approach you take with clients, right? Like meeting them where they're at, sitting with them on the floor, going for a walk with them, right? Allowing them, when there is opportunity, to take control back, to empower them, to have that in this space that you all share together. I think that's really valuable as a provider. And it just, I think, is a good reminder for any of us that practice in the healthcare field. Yes, we have constraints with our job. Yes, we have policies and procedures we might have to follow. But if we do have that opportunity to be a little creative, to be able to help the patient just feel more comfortable and feel like they have that space to be authentically them and comfortable, why not? So I do a similar approach as Chloe. I take patients on walks often if they're mobile, if they feel comfortable with that, if that gives them more of that creative brain space to be in, to just unpack situations. And then sometimes, it's moving to a different space. If the space we're in just doesn't have the right feel, maybe we move to, for my case, it's our wellness center, or come back to a consult room. So I think it's really important, if you have flexibility in your practice, to be able to utilize it. Riley, do you do something similar in your practice?
Yes, lots of walks. Or I've had clients in the past where we've painted together, both separately during COVID. It was like meeting via Zoom was really difficult for them. And so they were like, I just need a distraction. And they felt it was a lot easier to communicate when they weren't staring at a screen. Totally. So we just kind of painted together, or whatever artistic thing that they had in the moment. But sometimes it's things like that, or even like switching chairs or changing the space, or you can get creative with it.
Yeah, it makes me think, with a quick aside, like I'll do challenge meals with patients. So if we're really uncomfortable with a certain food, or we have fear surrounding a certain food, we'll eat together, because maybe that individual doesn't have someone to eat with, or they're not comfortable eating with other people in their household. And so we get to kind of create a space where we build that comfort. And we break down that barrier surrounding that food. And so, they get to choose it, and I will bring it. And we might be on a screen, like you said, eating across from each other. We might be in the same room, but I think it just really provides a different level of care, and it accesses something different for that client, for that patient. With that, Chloe, since you have such this dynamic background, you started in dietetics and then you transitioned over to mental health therapy. Do you see any parallels between trauma and nutrition in your current practice?
Yeah, absolutely. I mean, there's so much overlap between the mind and the body. And trauma can show up truly in every area. So things like anxiety, depression, those are going to impact the way that we eat. With anxiety, we might have like a constricted appetite because we're in fight or flight mode, and so it's really hard to eat. Or we might overeat to compensate for the times when we can't eat. With depression, I mean, it might be really hard when you are feeling really depressed to prepare meals and eat meals that have nutritional value. Things like disordered eating behavior can be rooted in trauma, exercising not enough or too much, even obsessive thoughts or compulsive behavior around food and nutrition. All of these things can be rooted in traumatic experiences. And really, all healthcare professionals need to be aware of this, especially professionals who are going to make recommendations related to diet and exercise. It's really crucial that you understand your client's background with these things and treat the whole person, not just the nutrition or exercise aspect of their well-being. Also, when I studied nutrition and dietetics, an area that I really focused in on was people's body image and the way that they view their own body, because that can be directly related to trauma and can impact their choices around food and nutrition. And then food and exercise can also be used in many different ways to cope. And so there might be some underlying mental health stuff going on that food and exercise can be used to soothe. And you really want to be aware of that as well. And I think for mental health providers, when I'm working with clients, I really try to always check in on, like, what does your physical health look like? How are you taking care of your physical well-being? Are you sleeping enough? Are you exercising? Are you moving your body? Are you able to eat? What does eating look like? Because, you know, we need our basic needs to be met also in order to work on our mental health. So all of this is so overlapping always.
Absolutely. And I think it's so important for all of our domains, whatever provider or practitioner you are, even if you can't get into the deeper layers or the nitty-gritty, just to check in, like baseline on those different aspects, right? Like, how is our physical wellness doing? Because you might get a piece of that story that other provider might not get. And that might be really core or central to figuring out a different avenue for treatment, or if you are lucky enough to work with other types of providers, to provide them that information. So I think that's, really brilliant, really well said. Any comments on that, Riley?
No, I think just absolutely we can all work together and provide a whole person approach or care. I just met with someone yesterday and did a mental health assessment and sent my assessment over to this person's provider that they've been seeing for years. And it was really curious, the conversation that came up with the provider of like, oh my gosh, I learned so much about them because they do kind of the same, not same sort of thing, but they know this person in a very specific way. And then I get to know them in a different way. And so if we're able to collaborate care, I think it's just, it's better care, right?
Yeah.
So
absolutely. Yeah, it's super valuable. Chloe, we have one last question for you, which is, do you have any advice for someone who wants to provide a more trauma-informed approach, whether they're a medical provider, they're a mental health counselor, a therapist, a friend, a family member of someone that's experiencing trauma?
Yeah, I love this question because I think, Riley, you mentioned this at the beginning, going through grad school and coming out into the field, the phrase trauma-informed approach, trauma-informed therapy was out there a lot, but I was always like, what does that mean though? Like, what does that actually look like?
Totally.
And it kind of took some trial and error and some experimenting and some experiences before I kind of got a grasp. And I'm still learning every day to what this approach looks like and what it means, because it changes from client to client, from setting to setting. So I think overall, approaching situations with curiosity and patience. You're not going to get to the root of what's going on in your first or second or even fifth meeting with someone. It's going to take time and it's going to take building a relationship. So patience and curiosity is the overarching approach. Asking what the client needs. So maybe encouraging them, if you know that they have trauma in their history, encouraging them to write out a plan. Like, hey, when I feel activated by trauma, here are some things that are helpful to me. Could be things like smelling an essential oil, holding an ice cube, or here are some things that are not helpful to me. Could be asking me questions, yelling. So that way the client can put into words what they need from you in moments when they feel activated. Not assuming you know what they need from you. We all have our areas of expertise. The client or the patient, they are the experts in their life, and they're the experts in what they've been through. Also, we all know the phrase, treat others how you would want to be treated. I actually don't think that phrase is helpful in trauma-informed care because I am different from the person in front of me. So treat others how they want to be treated. Ask them what it is that they need because it might be different from what you would need. I think this is relevant, especially for mental health clinicians, but also for any healthcare provider, that you need to avoid forcing people into disclosing their trauma before they're ready to do so. Again, it might take years. You might have to work with someone for years before they feel comfortable sharing with you what they've been through, or they may never share it. And that's okay too. You can still help them. But an example of a way to do this, so as part of our mental health assessment process, we ask about trauma history. So I make sure before I ask about trauma, I make sure to say, I am going to ask you some questions today about the things that may have happened to you in the past that may still bother you today. You do not have to answer these questions today. You can say yes or no, but not go into specifics, or you can decline to answer completely. And I find that saying this first allows clients the chance to be like, no, thanks, and that's okay. Also, when a traumatic event happens to a person, a really important part of that is that their autonomy, their ability to decide what happens to them, is taken away from them. And that's traumatic. Losing your autonomy, that is a traumatic event. And so it's important that you instead honor people's autonomy, their freedom, and their choice throughout their interaction with them. So some ways to do this: set up your office so that the client or patient doesn't have to walk past you to get out the door, so that they feel like they have a clear path to exit when they need to, no matter what. Letting them know at the beginning of your work with them that they're free to leave at any time. They're free to stop working with you, that they're in control in this room. Also, be predictable. Traumatic events are often scary because of how unpredictable and uncontrollable they were. So you can provide the opposite experience by saying what you're going to do before you do it, giving a roadmap of what your time with them will look like. And then when you say you're going to do something, follow through and do it. An example for mental health clinicians would be, at the beginning of a session saying, today we're going to be making your treatment plan. This will look like us setting goals together, and it will take about 45 minutes. For medical providers or people that are more physically hands-on with patients, telling them before you touch them. So something like, you're about to feel my hands on your forearm. This makes people feel like they have control or can make them feel more comfortable in their interaction with you. Also, none of this is going to work every single time, and it's not going to work with every single client or patient. And you will make mistakes, and inevitably you will accidentally activate someone's trauma. And so when this happens, it's okay to repair, and that can be very healing for a client or a patient. Because usually in the past, when they've been harmed, the person who harmed them never came back and said, "I'm so sorry. How can I make this right?" and repaired that relationship. So just a simple acknowledgement of like, wow, I just stood up really fast and that really activated your trauma. I'm so sorry. I did not intend to harm you. How can we work through this together and get you to a place of safety again? Because none of this is about being perfect. We're all people. And I think doing what you can to care for the relationship and having good intentions is what matters at the end of the day.
Mm-hmm. Wow, that was so beautifully put. As a provider, and it has me thinking of different ways maybe I want to adjust my approach, right? Like we're always still learning. Even if I think that I apply, a trauma-informed approach, I still have ways to modify as a practitioner. So Chloe, thank you. That was so, so well said. That was brilliant. As we close out today, I think that was a really excellent spot to end things, but we always love to give space for any final thoughts or takeaways or realizations, because these conversations, like I'm reeling over here in my head, it elicits different things for each of us. Riley, do you have any final thoughts or takeaways from what Chloe's provided with us today?
I mean, I guess I'm thinking more about not something that we've touched on a lot yet. Maybe we can chat a little bit more about it later in the episode, but kind of vicarious trauma, how it might show up for therapists and practitioners, especially as we're like trying to provide a trauma-informed approach.
For sure.
I think it's really easy to get in that routine of, caring for others and just helping and showing up, but not necessarily protecting ourselves.
Mm-hmm.
So definitely something that I am guilty of. Yeah, so I think this is just a good reminder to continue taking care of myself, which, for me, it means taking time off and spending time with my family and setting boundaries.
Absolutely.
But really as a way that I can continue providing this care for other people, because sometimes it's such a gift that we get to hear and listen to people's experiences and hold their trauma, but it can be really heavy sometimes.
It can be.
So just gentle reminder for myself and maybe anyone who is listening, because it's essential to take care of ourselves, to be there to show up for ourselves and for other people. So
yes, it is.
Anyways, Chloe, thank you so much for joining us today. We really, really appreciate you taking the time to be here and discuss trauma-informed care, which is such an important and valuable topic.
Mm-hmm.
I really enjoyed hearing more about you and your approach, what you do, and how you infuse trauma-informed care into your practice. So thank you.
Thanks, Chloe.
Yeah, thank you both so much for having me. And it just fills me with so much hope that there are providers like you throughout the world who are working to provide trauma-informed care to people. So yeah, thanks for having me be a part of this conversation.
Absolutely. It was a pleasure. Riley and I wanted to take a little bit more time to round out today's conversation, dive into a few other topics surrounding our core theme of today. So, Riley, where we usually like to go is talking about the history, right? Like setting a little bit of the stage of where we've been and how that influences where we are today. Can you tell us a little bit about the history of trauma-informed care?
Sure. Let's get into it.
Let's do it.
Okay.
Yeah.
We've talked quite a bit with Chloe about what it is, but I was really curious to know about where it came from.
Mm-hmm.
So I'm going to go through kind of the major historical events that helped us get to what we know today as trauma-informed care. Trauma and traumatic events have been around for a long time, right? Well, it wasn't until the 1970s that there was more recognition of trauma and its impact. This was because of the Vietnam War and veterans that were struggling with psychological symptoms following. The term post-Vietnam syndrome was then coined. And another term that emerged around that time was called rape trauma syndrome, where researchers highlighted the impact following sexual violence. Both of these discoveries and observations kind of helped us get a better understanding of trauma and its impact beyond the combat or traumatic event. PTSD was officially added to the DSM in 1980, which opened a lot of doors for both research and treatment of trauma as we began to see trauma as a clinical condition. So fast forward to the 90s, the Adverse Childhood Experiences study revealed that early trauma has lifelong effects on health and well-being. This study kind of became the cornerstone for understanding the link between trauma and chronic illness. From this study, researchers created a 10-item ACE questionnaire. We still use the ACEs questionnaire today, and we use it as a tool to help professionals understand the impact of trauma and help us guide our treatment. In 1998, SAMHSA, which is the Substance Abuse and Mental Health Services Administration, funded the Women, Co-occurring Disorders and Violence Study, which emphasized the need for integrated, trauma-sensitive services for women facing mental health challenges and violence. In 2001, Maxine Harris and Roger Fallett introduced the formal concept of trauma-informed care, which was in their book called Using Trauma Theory to Design Service Systems. They outlined 5 guiding principles, which are safety, trustworthiness, choice, collaboration, and empowerment. Then in 2005, SAMHSA established the National Center for Trauma-Informed Care, helping organizations integrate trauma-informed practices. Today, trauma-informed care influences healthcare, education, criminal justice, and social services. It's not just a clinical approach or a treatment model, but it represents growth and transformation towards care that is based on compassion, understanding, and healing. Enough of the historical components. And speaking of healing, one thing that we have yet to cover today is nutrition. Sara, can you help me by discussing how nutrition could be impacted by trauma?
Of course. Absolutely. So Chloe touched on it briefly towards the end. It's important to dive into it a little bit more. So trauma impacts nutrition typically by affecting eating behaviors, such as using food as a coping mechanism for stress and emotional pain. And that's designated as a maladaptive coping strategy. So it's using food in an improper way. And so trauma often induces, as Chloe really well articulated, a loss of control. And so controlling food intake can provide an immediate, tangible area where the individual who has experienced trauma can exert influence and feel order. And so what it can create is perhaps this illusionary sense of stability or predictability in life when there's a lot of chaos. And why is that? Well, that's because trauma leaves individuals feeling vulnerable, feeling powerless, feeling out of control. So there's this collide, if you will, of trauma and often eating disorders. And that can take place via 3 main categories. There are lots of subcategories in the DSM-5 if you want to look further into that. But the 3 main categories would be restriction, binging, or purging. So trauma survivors often struggle with the challenge of managing and regulating intense or distressing emotions. So cue anxiety, sadness, fear, anger, the list goes on. And if we're in the category of binge eating and it manifests that way for a patient or client, it often serves as a temporary relief and distraction. While if we're in more of the restriction category, it can create more of a numbing effect. It can help suppress painful memories, feelings, and emotions that come along with trauma. So we also see eating become a self-soothing mechanism, and it can provide this sense of grounding. So it's a physical act of eating, let's say, comfort food. So think in your mind, listener, whatever comfort food initially comes to mind. Maybe it's something sweet, maybe it's something savory. And how does that feel to you. Typically, for a lot of us, it's a momentary sense of pleasure. For individuals that have experienced trauma, it can provide safety. It's an opportunity to escape from internal chaos or even provide maybe disassociation from reality. And so if you think about survivors of certain traumas, we're going to talk briefly about sexual abuse. Disordered eating behaviors may be a way to actually change that individual's body size or appearance to feel safer or to feel less vulnerable. And this can be an attempt to reclaim ownership, to reclaim control over their physical selves, or maybe disconnect from a body that feels like a source of pain or discomfort or even shame is wrapped up in all of that. I think a really, to me, searing and powerful example of this, if you've heard of the author Roxane Gay, she wrote a book called Hunger, A Memoir of My Body. Really, really good piece of literature. I highly recommend it for understanding this aspect of trauma and hearing about her story of living through this. So just a shout out to her. That's something that's really vulnerable to put out in the public space. And I think it is a testament to her strength and her power. And when we share vulnerability like that with the world, it can be a really important source of healing for others. So I just want to say we appreciate her for doing that. So if you get a chance to read it, listeners, please do. Lastly, trauma can cause a profound disconnection from the body's natural hunger and fullness cues. We sometimes call this in clinical practice interoception. So you might hear that term thrown around, and that's what it means. And so due to chronic stress and nervous system dysregulation, those cues get off track. We're not able to understand how those feel in our body. We get disconnected from it. So there's this inherent lack of awareness, and it can further drive an individual to impose external control. Maybe that's through rigidity surrounding food choices, habits, and practices. And then we move to the physiological impact of trauma on the body in the sense of how it impacts the GI tract. And that's entirely linked to nutrition because that's how we digest our food. And so what we have noticed and seen with trauma is that it actually can promote damage to the gut lining, which is really interesting, and lead to a condition coined as leaky gut. Often leaky gut is brought up surrounding celiac disease when the microvilli flatten out and the gut lining becomes more permeable and things kind of leak in or leak out that we don't want leaving or entering the GI tract. So we often see it brought up in that space in clinical practice. But essentially what's happening is you get this disruption to the gut microbiome. So this imbalance begins to cultivate and get created in the community of bacteria that live in our gut that are essential for digestion, for immune system health, and neurotransmitter production, which is critical, as we've discussed in earlier podcasts, to our mental health and well-being. And what happens is inflammation begins to build in the body. So we have damage to the gut lining. We have disruption to the type of bacteria that's living in there. We get perhaps systemic inflammation that starts to affect brain health and how we show up in the world and how we connect with others. And all of that increases risk of chronic disease. It's multifaceted. And as you can see, there's a really important relationship of having quality nutrition support so that it can be maybe transformative and supportive to the GI system when we're at this state, when we're experiencing any trajectory of trauma.
Yeah.
Mm-hmm.
It's just always so fascinating to hear about our overlap of professions because we know that the brain and the body are so interconnected, but it's easy, I've said it before, it's easy to stay in our lanes and not really collaborate, contribute to one another's side of things when they're so interconnected.
They're so intertwined.
So yeah, thank you for sharing that.
Absolutely. My pleasure.
Well, let's shift gears a little bit.
Of course.
In our podcast episodes, we often explore misconceptions out there or myths, right?
Yep.
One big one that came up to my mind for this episode as we were prepping for it is the stigma and misconception of trauma or what trauma can be. For example, people often view trauma or PTSD as impacts only gained from experiencing events like, think war or combat. However, trauma or PTSD, which, quick little side note and reminder, just because we experience a trauma, it does not mean that we automatically meet the criteria for a PTSD diagnosis.
Exactly.
But trauma or PTSD can stem from a variety of factors. When we talk about trauma, we're talking about the spectrum of human experiences that can impact both our minds and our bodies.
Exactly. Yeah, and to take that a step further, trauma can be classified as acute. So reminder that that's a time-limited event. And let's give you some examples of what that might be. So that could be a terrorist attack, a natural disaster, flood, tornado, hurricane, a sexual assault, a car accident, maybe a major injury, or a sudden loss of a loved one. Trauma can also be chronic or a complex trauma. So that results from prolonged or repeated traumatic events. So one that is significant that pops up quite a bit is childhood abuse or neglect. This could also be chronic bullying. This could be living in a war-torn or conflict-heavy area. It could be religious trauma. It could be long-term racism or discrimination. And of course, it could be domestic violence. We also see an element called multi-generational trauma. So that is collective trauma experienced by a group with effects that are passed down through generations. Examples of that would be slavery, genocide, and the Holocaust. And then something that you spoke to, Riley, before you wrapped up with Chloe was that secondary or vicarious trauma, right? And that's where an individual can witness or listen to another person's trauma. So think of a clinician, a mental health provider that's listening to someone's trauma and experience trauma themselves. An example could also be, think about a first responder. How much first responders see because they're the first ones on the scene of an accident, something pretty traumatic. So that could have impacts on that individual, and that's not something to take lightly or be dismissive of just because they're not the one that is directly, injured or has a head wound or because they weren't involved in war. Trauma is really extensive.
Yeah, definitely. So if you're out there listening and you have some relation to this or are recognizing trauma and how it pops up for you, just take care of yourself and take note of how it might pop up, right?
Absolutely. Yeah.
Trauma can take different forms. It's not really a one-size-fits-all approach. I mean, like Sarah said, it can be a single shocking event, something that happens repeatedly over time or passed down through generations. It can be complex. So that's where our work with patients becomes so important, because we're able to understand the trauma and that the way that the trauma presents itself is on a spectrum and really tailor our approach to the care that's needed. So let's chat a little bit more about how we use trauma and what it looks like with patients.
Yeah.
So the first thing that comes to mind for me when I'm thinking of using a trauma-informed approach is safety. It really is setting the tone for therapy, kind of discussing expectations of what it's going to look like, but also taking the time needed to build trust with your client. So really taking the time to build that safety and the trust with the person.
Yeah.
So, that may include understanding their history and the components that might impact the therapeutic alliance and the work that's happening in therapy. There's this tool that I think of that we use a lot in kind of trauma. It's called the window of tolerance. It's basically a concept where it's a range of emotional capacity that one might have coming into therapy, and something we think of a lot when they've come into therapy with trauma. Within the window, we can think clearly. When we move outside of our window, we all have different kind of windows and sizes.
Yes, we do.
When we move outside of the window, trauma responses are more likely to kick in. And I bring this up because as a therapist, I know that someone coming into therapy that has been exposed to trauma might have a smaller window of tolerance. The goal is to expand it over time, but knowing where the client's limits are and not re-traumatizing them. by pushing them too far outside of their window. So it's kind of a helpful tool that I like to think of like, where are they at today? Because their window might change day to day.
Of course.
But really trying to expand it over time. I really try to empower clients to collaborate with the treatment process. They're setting their treatment goals. I'm not setting their treatment goals. And being mindful of what their specific trauma responses might be to avoid re-traumatizing them.
Absolutely. That's such a mindful way to create the proper amount of space for what the client is bringing into the room or on your walk and allow them to find comfort and healing to keep pushing their borders of tolerance in a safe way. That concept is really, I'm a visual person, so that's really visual for me, and that's really helpful to think of it that way. So in my practice, using a trauma-informed nutrition approach recognizes that maladaptive eating habits may be trauma responses. It's not simply poor fueling choices at play, right? There's usually more under the surface, right, that we want to dig into and be understanding of for that patient. So the goal with nutrition therapy with a trauma-informed approach is to address the root cause, right, with a focus on avoiding shame, blame, or guilt. Because I know, none of those are constructive to long-term or sustainable change. So when you're working with an individual that has experienced trauma, the goal is to build resiliency and empower this patient or client to understand how trauma has impacted their relationship with food and their body. And that's my favorite part, is the empowerment piece. Like, that's the best part, is to help people like reconnect with self. And so that's the goal. So if we don't have that opportunity, or we don't take that opportunity to get to the root cause of whatever these maladaptive behaviors are, views, mindsets surrounding food and body, we miss such an essential opportunity into helping this individual make progress if we haven't first addressed that underlying trauma.
Sure.
Right? And had this different mindset as a practitioner that it's more than poor eating habits. There's more at play. I need to take a different approach. I need to look at things a little bit differently. So for a high-level overview, just to provide some key nutritional strategies, whether you're a clinician or you're an individual that you're actively experiencing trauma, something I would really focus on is ensure that you have adequate consumption of protein. Protein is really key to supporting the production of neurotransmitters and tissue repair. We don't want to over-protein it. We don't want to over-consume, but we want to get enough. We don't want to under-consume. Increasing intake of magnesium-rich foods is important for proper nerve function and muscle relaxation amidst high levels of stress, which is chronically experienced when we are undergoing or actively in trauma. And then another important focus would be to stay hydrated. Hydration is really valuable in many ways. It's important for optimal cognitive health and GI function. If GI function is already not going super well, we want to make sure that it's being helped out. And a few other key points of focus would be anti-inflammatory and nutrient-dense foods. We talked about systemic inflammation and the impact of that. So we want to make sure that we're helping bring down those levels. And then, of course, probiotics have to have a little nod to them because those are productive and helpful to the GI tract. So we talked about leaky gut imbalances in the terms of the types of bacteria that's being cultivated. So probiotics could be really constructive here. And then lastly, I would say a really valuable area to look into with a dietitian, whoever is on your care team providing nutritional support, is to reduce caffeine or other stimulants. As we know, what do stimulants do? They can increase cortisol. They can increase our stress hormone, and we want to lower stress. We want to improve sleep because sleep is important to recovery. So those are all aspects I think are really important to hit on, especially if you're trying to support a patient or you're trying to take care of yourself or a family member. Those would be some really great places to begin with nutritional care.
Yeah, great. I really love that you highlighted the importance of addressing the underlying cause and issue, because I think sometimes people come in of like, I want to change my eating habits or whatever it is, that surface level thing.
Yeah.
And oftentimes there's a lot more underneath the surface. So thanks for touching on that.
Of course.
It just aligns so well with what we strive for when using a trauma-informed care approach.
100%.
So as we start to wrap up, a quick reminder that trauma-informed care or trauma-informed approaches are guided by the key principles of safety, trustworthiness, peer support, collaboration, empowerment, and cultural sensitivity. These principles aim to create environments that acknowledge the impact of trauma, promote healing, and avoid re-traumatization by fostering a sense of security, transparency, and respect for the person's experiences.
Absolutely. Definitely let that all soak in on what trauma-informed care is and what it emphasizes and attempts to cultivate. We'll wrap up our conversation there for today. Thank you so much for being here with us and listening to the Be Well Collective. Take care of yourselves, take care of each other, and as always, take care and be well.
Bye, y'all.
Bye.
Thanks for listening to the Be Well Collective. If you have any ideas for future episodes or questions, please email bewellpodcast@aruplab.com. If you liked what you heard here, rate and subscribe for more. The information provided in this podcast is for educational and informational purposes only and is not intended as medical advice. ARUP Laboratory and the Be Well Collective do not assume responsibility or liability for the actions, decisions, choices, or opinions of the individual listener. The content shared should not be used as a substitute for diagnosis, treatment, or medical guidance. Always consult with a qualified healthcare provider before making any changes to your care plan. Listening to this podcast does not create a provider-patient relationship. Use your discretion and take responsibility for your own health decisions. This show is produced by Riley Speth and Sara Hillring. Today's episode was audio engineered by Riley Owen.